Examining the health-illness continuum. Introduction. The health-illness continuum is a concept that reflects a person's overall wellness graphically. Presented by John Travis in 1972, this model is a continuous and non-static system of transitional human states from the movement of the bottom to the center, the top, or the reverse. In this case, it is essential to note that throughout life, an individual tends to experience various health conditions and diseases. Thus, the health-illness continuum demonstrates this change procedure in an accessible, systematic, and logical form. Moreover, there is a wide range of different levels of illnesses in health, and well-being does not always mean the absence of ailments, since the human body is a rather powerful and multifaceted mechanism. Importance. The perspective is one of the most significant concerning human experience in health, from a deep understanding of a person's condition, and eliminating existing gaps in patient care. In medical practice, such modeling of transitional states allows one to comprehend, define, analyze, and predict the correlation of inflammatory processes with healing. In particular, this approach is vital for obtaining the necessary biological information at the level of detail required for detecting and diagnosing ailments. For example, determining the disease's stages will allow a medic to get a more comprehensive and accurate picture of a multifactorial, chronic condition. In addition, according to Kishan, the health-illness continuum is the key to going beyond neutrality to achieve a high level of recovery in physical, mental, or moral terms. Consequently, this model gives nurses or doctors advantages for implementing effective and efficient assistance to a patient and moving up the scale. In general, the duties of this concept are not limited, and its role is exceptionally relevant and influential in the healthcare environment. Promotion of the value, dignity, and human flourishing. Primarily, it is essential to note that understanding and awareness of the essence, meaning, and idea of the health-illness continuum allow a healthcare provider to promote the values and dignity of citizens to achieve prosperity and well-being of society by fostering preventive treatment that improves an individual's well-being before the first signs of a particular disease, as well as teaching patients to be aware of potential problems, avoiding pathologies and premature death. As practice shows, focusing on disease prevention brings positive results in terms of reducing the prevalence of illnesses, adverse outcomes, as well as healthcare costs, to redistribute funds to other equally important needs of people. Therefore, comprehending the characteristics of the health-illness continuum can become a strategy for improving the quality of life and increasing the lifespan of individuals or groups for full functioning in society and interaction with people. Reflecting on the overall state of health. The behavior that supports the student's health is based on proper nutrition, physical activity, psychohygiene, the exclusion of harmful substances, and regular preventive examinations for early detection of diseases and timely treatment. In particular, a healthy life is associated with three essential elements as quality sleep, an appropriate diet, and moderate physical activity, the combination of which makes it possible to improve a person's mental and physical condition. In contrast, behavior within the framework of insufficient quantity and quality of sleep, periodic alcohol consumption, untimely consumption of food following the internal clock of the body, experiencing stress at work, and several other aspects worsen health and well-being. Therefore, in this case, a special approach is required to correct this behavior and exclude several phenomena included in such behavior. At present, their state of health and body is at the neutral stage of the health-illness continuum. Hence, this means that there are no visible signs of any diseases, but at the same time, it demonstrates the potential for moving up the scale for the better. Consequently, the decision to move towards optimal health and a high level of well-being depends on the medical student. Options and resources. Among the available effective and efficient options for promoting well-being, one can single out an established lifestyle based on rational nutrition, a physically active life, giving up bad habits, emotional well-being, the allocation of time for rest, and much more. Accordingly, the resources in this situation will be the skills to take care of oneself, as well as knowledge about maintaining a healthy lifestyle. These options and resources are significant and invaluable, ensuring the health of not only the student but also the whole of society. Therefore, the main thing in a healthy lifestyle is the active creation of health, including all its components. Without any doubt, the above aspects will help the student move towards well-being through the implementation of conditions for ensuring physical, mental, and social well-being in a natural environment and active longevity. Taking note of the indicated options and resources, the student creates the best conditions for the normal course of physiological and mental processes, reducing the likelihood of various diseases and increasing the quality and duration of life. This will help fulfill some goals and objectives, successfully implement plans, cope with difficulties, and, if necessary, colossal overloads. Conclusion. Summarizing the above information, it is necessary to state that the health-illness continuum is a system illustrating the state of human health. Its importance and significance are mainly expressed in the health system. Understanding this concept, a medical specialist has the opportunity to direct his actions and decisions for the benefit of an individual, a group, and the whole society.